We're going to talk about your health now. And as a result of that chronic problem that we have in the valley, the diabetes. Oh man, we love barbacoa and Big Red and flour tortillas and carne guisada. We just like that too much. Oh, and pan dulce. I can't forget the pan dulce. Yeah, we got to change our culture, eat a little better, but we got too much diabetes. As a result of that, some folks find themselves in a medical situation where they need a new kidney. And on behalf of our friends and partners of many years, we've been with DHR Health from the very beginning when they were just day surgery, and now it's a massive hospital. There's so many different institutes, and one of them is a transplant institute. So I want to bring aboard a new friend that we've made over the past year. He is the medical director. He's the director of the DHR Health Transplant Institute. Comes to us from North Texas, from the Fort Worth area. And let's start with, from your perspective, Doc, the history of the Transplant Institute at DHR Health. How many years has it been up and running? We're doing kidneys now, and I was told a long time ago, several years have gone by, well, that the next step might be like liver, right? Liver transplants. But let's focus on the history here at DHR Health, how it's comprehensive, and then where do we go from here? Go ahead, sir.
Yes, sir. Thank you for having me. So, DHR Transplant Institute got initial approval for opening a transplant program in 2016, and we did our first kidney transplant in 2017. So, we have been open for almost 8 years now. We have been doing during the recent years about 30 to 40 kidney transplants per year. But last year we ended with 101 kidney transplants.
My goodness. So how did you cross the 101? If you were doing 30-ish year, and last year you crossed 101 last year, did you bring aboard more kidney doctors, more surgeons? What happened?
Absolutely. In the valley, because of high prevalence of diabetes and hypertension and obesity, we have seen high rates of kidney failure. Thousands of patients on dialysis, and these patients don't have resources to go elsewhere. Hospital increased the resources to bring more physicians on board, more team members on board to do more transplants so that patients have the comprehensive transplant services here in the valley. So they don't have to leave the valley for expert care that is required for this particular field of medicine.
I suspect that a lot of things need to happen before somebody is placed on the donor, like to receive a kidney, right? There's many different, as a kidney doctor, like what needs to happen for you to eventually land on a kidney transplant list?
We are primarily looking for patients that are on dialysis currently, or
Okay.
anybody that is not on dialysis who has kidney function below 20%. So they're eligible to go on the transplant kidney wait list. And across the US, there are almost 100,000 patients waiting for kidney transplant. In Texas, about 10,000 patients are waiting for the kidney transplant.
Oof, my goodness, that seems like a lot. I've heard that family members sometimes can step in and donate a kidney. So how does that happen?
Absolutely. There are two kinds of kidney donations that happen. One is deceased donor kidney donation, where somebody that was in a car wreck or was severely sick that passed in the hospital, and if they are registered donors, if the family consents, their organs can be procured to help patients in need. And second kind of kidney donation happen from living donors. These are the people in the community, family members, friends, church members who are in perfect health. They don't have any medical conditions. They're not overweight. By donating a kidney, they're not putting their health at risk for future. So these are the two most common kinds of kidney donations we get, and living donors typically those transplants from living donors typically do well. They work right away. You don't have to wait years on the kidney transplant wait list, and they last longer. So we promote living donations more than deceased donations.
Dr. Sridhar Allam, kidney doctor, a nephrologist, DHR Health. He's the director of the Transplant Institute at DHR Health. Big news for them in 2025 after being on a pace of doing about 30-ish some odd transplants, kidney transplants every year. Last year, they had a grand slam. They went to 101 in 1 year. So are you on pace to hit that number this year? Maybe surpass it, or is it too early to tell?
We are hoping to do more transplants than 101 transplants that we accomplished in 2025. So we're hoping to do anywhere between 120 to 150 kidney transplants for this year.
Mm.
There are lots of patients on dialysis in the valley. Obviously, they have a lot of medical problems. And in the past, we were very conservative in recipient criteria as well as donor criteria. We have been more proactively reaching out to these patients, help them lose weight, help them overcome the barriers for transplantation so they are healthy enough to go through this major surgery so that they can be free of dialysis, they can have better quality of life, fewer restrictions with diet, travel, and also live longer so that they're there for their families for many years to come.
That was going to be my next question. If there's something that you can do outside of surgery, for example, you mentioned the 20. Some folks that have 20% capability in their kidneys, a function in their kidneys. So I'm guessing what diet, exercise, that might help either preserve it or can you increase function if you lose weight and fight the diabetes? Can you increase function, or you're stuck at 20? You want to keep it at 20? How does that work?
So typically, you once you are on a slippery slope, you continue losing the kidney function unless you keep your blood pressure under very good control, keep your diabetes under control, follow a healthy diet and lifestyle so that you keep your weight under control, help lose weight. Then hopefully we can get more mileage out of those kidneys, and hopefully these patients may not, have to hit dialysis sooner than they have to.
He's the director of the DHR Health Transplant Institute. It's been up and running for surgery, but was in 2017. Last year, they crossed the 101 mark as far as kidney transplants in 1 year. Might be doing a lot more. Dr. Sridhar Allam, kidney doctor, joining us. After surgery, Doc, how does life change for the donor, if it's a living donor, and for the recipient?
So for donor, typically the surgery is done laparoscopically, so their recovery is much faster,
Wow.
and they spend about a night or two in the hospital, and then they come for follow up about 2 weeks after the donation, and they're usually good to return to work in about 4 to 6 weeks, and they come to transplant center every 6 months for the first 2 years, and we encourage them to see a primary care doctor at least once a year afterwards for the rest of their lives. They have to follow a healthy lifestyle. They don't put on weight, they don't develop any high blood pressure, diabetes, and they got to monitor their blood pressure. They have to have yearly physicals for rest of their lives. I always tell my donors, you are perfectly healthy at the time of donation. You have to maintain that health. That is a promise they have to make so that it is safe for them in the long run. For recipients, typically they stay in the hospital for about 3 to 4 days, and they come for follow-up visits at least twice a week in the first month, once a week in the second month, every 2 weeks, and once a month afterwards. So they become free of dialysis. Most of these patients are going to dialysis 3 times a week, being tied to the machine about 4 hours each time. They have a lot of restrictions on their diet. They have a lot of restrictions on their fluid intake, and they have restrictions on travel because they have to arrange dialysis and whatnot. So by transplanting them, they become free of dialysis. They have fewer restrictions with the diet, so they get to enjoy life better. They get to travel, and more importantly, they're going to live twice as long as they would if they were to continue dialysis. You are increasing their lifespan, and you're giving a better quality of life.
I think it was you who told me in one of the previous interviews when I met you about a year ago. You were telling me that if 5 years, right? That's after. Usually, that's the span of time. A new kidney will help you, right? About 5 years or so, something like that.
Typically, depending on the age group, if you're a younger patient on dialysis, they probably have lifespan of 10 to 15 years. If
Okay.
you're over 65, lifespan on dialysis is about 5 to 6 years. Whatever that lifespan is, depending on what age group you belong to, transplant will double it up. If you have 10 more years to live, transplant will potentially make it 20 years.
And I think it was you who told me. I didn't know this, and I had to share it with the audience. I find that fascinating. Uh, the diseased kidney, uh, it's not removed, right, doc? Like, it's like you connect the new kidney. It's an appendage to the old kidney, right? Is that the way it works? And then if they need
Correct.
another transplant, you put another one. They just keep putting more kidneys on, right?
That's right. So typically we don't remove the old kidneys. They
Mm.
are in the upper back, and we connect the new kidney in the right lower abdomen. So typically they end up with an extra kidney. We are actually recently have been doing double kidney transplants. These are the kidneys that came from older donors. So for them to get enough mileage out of those kidneys, we accept two kidneys for one patient. So that means, some of these patients end up with four kidneys, two of their own that are not functioning, and two new kidneys that are going to help
It
them
almost sounds like you're
keep
running.
them up.
Yeah, get 2 for 1. Buy one, get one free.
That's
Right.
what it is called. That offer, when we get those kidney offers, these
Yeah.
double kidney offers are called 2 for 1. And I
I
tell my
guess
patients, buy one, get one free.
yeah, that's what I love. Doctors with a sense of humor. I love it. Such a serious matter. Hey, tell me about the next level. Since you're in DHR Health is in 8 years now with the Transplant Institute, liver or anything else. Where are we as far as taking it to the
Right.
next level?
And in the valley, because of obesity and diabetes, we're also seeing a lot of fatty liver disease. And,
Yeah.
liver failure is the ultimate disease state that these patients may experience. Not as much as kidney failure, but there is enough liver disease in the valley that DHR Transplant Institute is ambitioning to open a liver transplant program as well for quite some time. And we are putting all the pieces together. Again, bringing experts in liver transplantation is a big challenge in South Texas, especially in the valley. So we are currently hoping to recruit a transplant hepatologist, meaning a physician expert that is able to take care of liver transplant recipients, transplant hepatologists. That is the last missing piece that we have. We have the surgeons, we have all the team members that we require to open a liver transplant program. Once we get a transplant hepatologist hired, hopefully we'll be able to open the liver transplant program in near future.
I think it's probably important to emphasize and close with the fact that having a comprehensive kidney transplant center at the Institute at DHR Health, you don't need to leave town. You get everything done from A to Z, from pre to post, and then maintenance afterwards there at DHR Health. So, congratulations on the 101 kidney transplants for last year. Was it true that you guys celebrated? You didn't do cake and Coca Cola and punch and pizza. You guys, what, just ate was like some soupy kidney beans. So that was a and water, keeping it healthy. That was a celebration. That was a bad joke. Sorry. All right, Doc. At least you're smiling. At least I got you to smile. Thank you, Doc. Continued success. Call us
Thank
again.
you.
We're hoping for even bigger, better news in the near future. That is Dr. Sridhar Allam, kidney doctor. He's the medical director at the DHR Health Transplant Institute. Be well, Doc.